Hello, I'm Dr. Jeff Smith, author of the book Living Pain-Free, It's Your Choice. Now I'm board certified. We treat our patients neurologically and metabolically. That means I literally wrote the book on the neurological and metabolic treatment of bulging and herniated and prolapsed discs. We wrote the book on it. If you're watching this video, you probably have suffered from herniated discs, bulging disc. You know somebody that has. You maybe know somebody that's gone through surgery and it's failed, like most of it does. You yourself may have gone through surgery and it failed. Okay? When I talk about these types of things, we're talking about how to rid these things of your problem, of your life, how to get rid of them, how to eliminate them. Okay? Not how to take pills, not how to cover up the symptoms, how to literally get rid of the problem. Alright? We're here to talk about it. How do you fix neurologically and metabolically a problem like a bulging or a herniated disc? If you're watching this video, I want you to check out our website. It's www.thechronicpainclinic.com. Again, thechronicpainclinic.com. There's all kinds of information on the website about what we do, and you'll even be able to hear from patients that we've treated and relieved of their problems. Their story is on that website. Their successes are on the website. Okay? What makes us so different? How do you end your chronic health care condition nightmare? One of our patients had 8 back surgeries before they came to us. 8. Okay? What makes us different? We treat our patients metabolically and neurologically. Alright? Metabolically and neurologically. Well, what does that mean? Well, if you have pain in your back or neck, numbness in your hands or feet from a bulging or herniated disc, when we examine you, I'm here to tell you we're going to leave no stone unturned. No stone unturned. I'm going to look at everything. I'm going to look at your metabolic panels. I'm going to look at your neurological tests. I'm going to look at your brain. I'm going to look at your spine. I'm going to look at your MRIs. Metabolically, how does metabolics affect herniated or bulging discs? Well, if your blood system is out of whack, if your hormones are out of whack, if your immune system is out of whack, there's no way you're going to get over this problem, no matter what surgery they do to you. We're going to look at thyroid panels, metabolic panels, lipid panels, complete blood panels. Now I know what you're thinking. Doctor, I've had the tests. The doctor said it was fine. We looked at the sheet of paper, it said it was fine. Why are you still sick? Doctor, why am I still sick? Well, when the lab runs the tests, it's going to have a range on there. Let's give thyroid an example here. Your thyroid on that lab says 0.5 to 5.0 is normal. 0.5 to 5.0. So your doctor will look at that lab report and say, oh, well, you're 3.4. Must be normal. Nothing wrong with your thyroid. And you look at your doctor and say, well, I'm still hurting. There's something wrong. Ah, you're normal. There's another thing that needs to be looked at on that test. The functional range. Not the laboratory range, the functional range. Another word for functional is optimal. Okay? The optimal range for thyroid is not 0.5 to 5. It's 1.8 to 3. And if you're at 3.4, your thyroid is actually too high. How do I know that? Run the tests. You got to run the tests. Okay? Sensitivity testing. We do a test called an ASI test on our bulging and herniated disc patients. Why is that important? Well, if you're sensitive to anything like wheat, gluten, oats, milk, eggs, yeast, or soy, you're going to cause inflammation in your body. Now, why is inflammation important in a patient that has a bulging or herniated discs? Well, number one, you're already inflamed big time wherever your bulge is. Okay? That inflammation causes pain. It can also cause fatigue or indigestion if you're sensitive to those things. Feeling bloated after you eat and just kind of feeling ugh right after you eat. Can cause vomiting or ulcers. Okay? All those sensitivities can make your inflammation inside your body worse and intensify the pain from your bulging disc. And if you don't address those issues, you're never going to get over the problem. Adrenal stress index, that's a test we run. Why is that important? Well, your adrenal glands that sit right on top of your kidneys, those are your stress organs. Okay? They control and regulate stress. If your body cannot regulate stress, and believe me, a bulging disc or a herniated disc in your neck or back is going to cause a lot of pain and a lot of stress. If your body can't deal with that, it's going to cause problems. It's going to cause you hormone problems, sleep problems, blood pressure problems. All of those are related to the adrenal glands. And if you don't run the test, you're not going to know. Okay? Autoimmune disorder. Why would an autoimmune disorder be important in a herniated or a bulging disc? Autoimmune means your body attacks itself. It's literally eating away at itself. So if you have a bulging or a herniated disc and your body's just chewing it up, what's that going to cause? Arthritis. Rapid arthritis. Okay? How do you know if you have an autoimmune disorder? Run the test. You got to have a doctor that knows what test to run. Okay? TPO and TPG. Those are antibodies for thyroid. Just as an example. Okay? Your thyroid controls a lot of things. Immune system is one of them. If your TPO and TPG antibodies are too high, you're going to have what's called Hashimoto's disease. What is Hashimoto's disease? Well, you're tired and you have unexplained weight gain with an inability to lose weight. Okay? That's Hashimoto's disease. Very simple. Doctor just has to run the test. If your immune system is attacking your nervous system, it will cause pain and numbness to intensify greatly in most cases. So if you have a bulging or a herniated disc, you don't want to pour gasoline on top of the fire, right? How do you know? You run the tests. Very simple. Okay? Those tests, those immune panels, give me an in-depth idea of what's going on inside of you so that we can fix it and change it. Okay? We also run tests like neurotransmitters. Why would neurotransmitters be important? Well, if your brain cannot properly fire to the rest of your body and communicate with it, irregardless of whether you have a bulging disc in your back or neck, you're not going to get well. If your brain can't communicate with your leg because the bulging disc in your leg won't let the signal get down, you're not going to get well. We have to test for that. Okay? Here's an example of a bulging disc. These two bones are literally smashed together, and I use the example all the time of a s'mores. Everybody's had a s'mores. It's a 2 graham crackers with a marshmallow between it. What happens when you push that together, that marshmallow? It goes, swells up, right? So is the answer to trim off the marshmallow? Just go in there and cut it all off with surgery and leave it smashed together? No. You got to pull it apart. Okay? You got to pull it apart. Neurotransmitters are what connect your brain to your leg. And if because that thing is being smashed, your brain can't communicate with your leg, you're going to have pain. Lots of it. Hormone pain.